Assalamu alaikum students. Welcome to lecture 10 in hospital pharmacy, and today's topic is nuclear pharmacy part 2. It is a continuation of the previous lecture of nuclear pharmacy, and in this one we are going to discuss more aspects of nuclear pharmacy. So, as you remember that in previous lecture we of nuclear pharmacy we discussed about we get introduced to the concept of nuclear pharmacy, what are radiopharmaceuticals, and how what are the various good practices regarding their preparation. Now, in this topic or in this lecture, we are going to discuss about storage about of radioisotopes, then dispensing of radiopharmaceuticals, distribution of radiopharmaceuticals, and its transportation. As far as storage of radioisotopes or radiopharmaceuticals is concerned, it is very important step, and it is required for all the following activities like their proper and safe storage. So as we already discussed that radiopharmaceuticals are not the normal pharmaceuticals, they have a radioactivity about them, and they continuously radiate. So this radiation can cause health hazards, whatever or whoever come across with these radiations. So their storage is extremely important step, first of all. And secondly, manipulations of radiopharmaceuticals is also performed in the same storage area, and therefore that's why also their storage is proper storage is such a critical step. Because as we already discussed that manipulation of radiopharmaceuticals is also performed in a very careful way. Usually micropipettes, which are a large distanced micropipettes, are used for the manipulations for taking out the radiopharmaceuticals out of their containers. Usually the pharmacist and do not go near to the containers once they get opened. A safe distance is maintained in order to protect them from the radiation. So a proper storage area is that's why extremely important step. Secondly, the calculation and calibration of the dose is also performed in the very same area. And apart from that, treatment area should also be kept separate. It is not like the normal treatment areas or the normal wards where the patients are kept and being administered with the drugs, but the area wherever the radiopharmaceuticals are being administered to the patient, that should be a separate area, and a proper good practices should be followed while administering the radiopharmaceuticals to the patients. Dispensing of radiopharmaceuticals. So, whenever the request is received by the pharmacist, radiopharmacist will carefully calculate the dose accurately. Accurate calculation and calibration is extremely important in the case of radiopharmaceuticals because these are containing the radioactive material that should never exceed the need of the patient. And so that's why there are certain criteria which are considered whenever the dose is being calculated, like and these are patient specific factors such as age, gender, weight, surface area, as these are the factors which usually affect the normal doses of the normal pharmaceuticals. Same thing is applicable to radiopharmaceuticals as well, but extreme care is required in this regard because radiopharmaceuticals could prove harmful if the dose exceeds then the required one. Radiopharmaceuticals are never delivered directly to the patient, as we know these are radiopharmaceuticals, so patient never knows how to handle the radiopharmaceuticals in a proper way. So these are never dispensed directly to the patient. Rather than these are usually dispensed to uh, the area where the trained staff is present in the hospital, whether the nurse or physician directly dealing with, or the clinic, and then they would administer it to the patient, and patient will never have a direct access to the radiopharmaceuticals. Moreover, another important thing regarding radiopharmaceuticals dispensing, they are always dispensed in a unit dose. They are always dispensed in a dose which is required once, and the dose never exceeds than that. Uh, the reason is very clear that the area where the dose is being administered to the patient, where the patient is being treated with the radiopharmaceuticals, might not be having the storage facility for which is required for the radiopharmaceuticals. So it is better to provide radiopharmaceuticals in a unit dose. Distribution of radiopharmaceuticals. Radiopharmaceuticals should never be distributed to random places except within a healthcare facility. Secondly, the syringes, as we discussed previously, that usually it is provided in unit dose. So they are provided in syringes having the unit dose filled with radioisotopes are lead lined and labeled in such a way that could be identified easily. Lead lined in order to protect or prevent the radiation to um, cause health hazard to the person who is taking it to the area where the patient would be treated with it. Transportation of radiopharmaceuticals. Whenever the radiopharmaceuticals are being transported from one hospital to the other, or one clinical setup or to the other, specific care is required because safe transportation requires safe packaging. Depending upon nature of radioactive material, three types of packaging can be used. One is called the industrial packaging, the other one is type A packaging and type B packaging. So, first of all, industrial packaging. Materials that present little hazard from radiation exposure due to their low level of radioactivity. So, industrial packaging basically carry or is suitable to carry those radiopharmaceuticals which have low level of radioactivity. Usually, the radioactive materials which are used in the radiopharmaceuticals are categorized in three main categories. The first one is the one which has a low level of radioactivity, the other one is higher, and then the third one higher than that. And that is potentially extremely dangerous. So, the industrial packaging is used for the one which has a low level of radioactivity. So those are shipped in industrial packages. These are also known as strong tight containers. And usually the products or the things which are shipped with the help of these containers or packagings are slightly contaminated clothing, which might be used by the pharmacist, physician, patient during the treatment or diagnosis purpose, and the laboratory samples which might be related to the diagnosis being performed using the radiopharmaceuticals are examples of materials that may be shipped in industrial packages. Then here comes the type A packaging, and after the industrial packaging, the next packaging is type A packaging, and as we discussed that there are mainly we can categorize the radioactive materials into three main categories, and the first one is the one which is having low level of radioactivity. The second one for which mainly the type A packaging is used is having slightly higher radioactivity than the previous one. So radioactive materials with higher specific activity levels are shipped in type A packages. Now, the criteria or the requirements for type A packaging is that they should demonstrate their ability to withstand a series of tests without releasing the contents. Means because usually the materials which are being transported with the help of type A packaging is not now the clothing or the samples, but it is actually the actual radiopharmaceuticals or the radioactive materials which are being used for medical use. Maybe it is treatment or maybe it is diagnosis. So definitely the radioactivity level would be higher. So for this purpose, type A packaging is used. Third packaging is type B package, and radioactive materials that exceed the limit of type A package requirement must be shipped in type B packages. Now here the materials comes which have got a radioactivity greater than the even the type A or the industrial packaging, and for this reason the design or the package which is being used for this kind of substances is radioactive substances is not should not only demonstrate its ability to withstand tests which are simulating the normal shipping conditions, but it should also withstand severe accidental conditions without releasing its contents. So this is the criteria which the type B packages should fulfill. Then in only then they can be used for these kind of or this category of radioactive materials transportation. And so very obviously, and we discussed earlier, that type B packages are used to transport materials with high levels of radioactivity. So the transportation also involves definitely the vehicles and containers. So um, placards and labeling is extremely important, which is being used, and labels which are used to identify the contents which are present in the containers is extremely important. Labeling is extremely important in pharmaceuticals, whether it is normal pharmaceuticals or radiopharmaceuticals, and definitely in case of radiopharmaceuticals is it becomes enormously important. And according to the three level of categories, as we have three kind of categories of the radioactive materials, labels are also of three kinds, and radioactive white one, which has almost no radiation. Then there comes radioactive yellow 2, which has a low level of radiation levels. And then the third label, which would be yellow, also yellow, but it would be having 3, and it means that it is the third category of radioactive material and it has higher level of radiation, so be careful.